why we are so lucky to be able to have a conversation with the vaccine champions today. I'm going to introduce them. The first one is Vinette Tyme. Vinette is the Director of Caregiver Engagement at Houseworks, and in this position, she oversees a team of caregiver engagement specialists who help Houseworks to foster an engaged and empowered workforce. Now, that's a lot of great words. What does that mean? We'll have a chance to actually ask Vinette and Marcia about their role and what they do. But before she came to Houseworks as a caregiver and then got promoted to the Director of Caregiver Engagement, she had a 30+ year career in Jamaica in customer service. And as we know, those skills in customer service really translate very well to caregiving. She also has been recognized in her leadership as a caregiving professional. She was interviewed by NBC10 and the Boston Globe about her virtual dementia training, and she's been awarded the Star Award from the Massachusetts Home Care Alliance. So kudos to Vinette. Next, we have Marcia Greenfield. Marcia is a caregiver engagement specialist and certified dementia practitioner at Houseworks. She helps to coach caregivers for success when working with home care clients. So again, this team of caregiver engagement specialists are really there to support the caregivers and be a resource for them. They're former caregivers, and so they're trusted by the caregivers. And like Vinette, Marcia brings a 30+ year history of working in a different industry. So in Jamaica, she worked as a school administrator, she was a court accountant, she served across multiple departments in the sugar industry, and transitioned to home care, where she's also been recognized for her virtual dementia training and was recognized for her customer service through this award of employee in customer service for 6 consecutive months. So Houseworks selected Marcia and Vinette to serve as their vaccine champions for their agency, and let's take a moment now and review what they told us about what they saw when they interviewed caregivers and when they talked to caregivers. They described 5 categories of vaccine readiness. So of course there were those people who were like, no, never, stop bothering me, I don't want the vaccine, right? That's like the hell no people. And then there's no, not interested, I don't want the vaccine, but they seem to still be seeking more information. Then there are the people who were not interested because they were just terrified. And then there are people who were kind of interested, but not really sure, who were seeking more information. And then of course, there were a whole group of people who just lined up as soon as the vaccine was ready. They didn't need any convincing. They had been waiting for the vaccine and they wanted to be vaccinated. So the majority of people they interacted with fell into 2 and 4, the ones who were information seeking. So they said they weren't interested, or they said they weren't sure if they were interested. But the thing that tied them together is that they were seeking more information, and that creates a really exciting opportunity to intervene. And so with that, I'm going to stop sharing my screen and see if our friends, yes, I see Marcia. Is Vinette with you as well?
How are you?
Wonderful. Okay, we can hear you loud and clear. Welcome back. I can see you both. You both beautiful on this fine Thursday morning.
Busy.
I believe it. I believe it. Well, thank you for joining us today. And what I'd like to start by doing is having you talk a little bit about your roles with the caregivers and why you think that you were able to build trust with them before you started working as vaccine champions.
I think the reason we were able to build trust was that we were caregivers first and foremost. So we worked with most of them, and over the years before we got this position, and they got to know us as a person. We, apart from the job, you might interact and every now and then, and they found that out, so they trusted. Also, during the heights of the pandemic, a year and a half ago or so, I was really at a building, a facility that we have cases, and there's an office there. And I was there like every day during the pandemic. And they saw me, went to the apartments, just called them, just, just walked the building to see if I could see them. And, it was a very tense moment, but I was there for support. So, because at that time, the head office was closed, people were working from home. So I think that is why they decided that, whatever we say, it can be trusted. Our word can be, they can trust us.
And also was a strength of support for those caregivers who actually got the COVID. Being there for them right through the time, the way we relate to them, gave them that confidence in us to believe in us and trust our words.
Yes, I had several who were quarantined because they got exposed, and maybe for 10 days, or they had to sit out the entire time. And every single day I would call them to see how they were doing every day during their quarantine period. And those who got the virus, I followed up with them, and they had to do a test before, get another PCR, and I was there all during that time.
That's incredible, actually. What I hear is a genuine concern about the caregivers, and that through your actions and through your outreach, people knew long before the vaccine came along that you had their best interest at heart. Which it's, as in our conversations before, you underline that as a really important prerequisite to being effective when it came to reaching out about the vaccine. Mm-hmm. So I'd love for you to, I'm gonna ask you to talk to us about the case when you have a caregiver who says, leave me alone, I'm not interested, stop bothering me about this stupid vaccine. Because we're going to do a role play with one of the information seeking, caregivers, someone who's not sure or who doesn't want it. But a lot of people have caregivers on staff who are it's like a dead end to the conversation. How did you approach those individuals, and what recommendations do you have for agencies who are facing a subset of caregivers who are just appear to be closed? Is it hopeless? What can they do?
What we use now is statistics.
No, before, what we did was listen to their concerns. First and foremost, you have to listen to them. Mm-hmm. Don't beat them down. Don't say, or whatever. Just listen to them and hear them out. Let them vent. And then we take it from there.
Give them the facts.
We give them the facts, right? But to get them to move from where they are to where we want them to be, you have to listen, and you have to be, show a lot of empathy, and for them to see that you're not telling them that they're stupid to be believing this and what, and then we take it from there.
And you're not forcing them to do it. Mm-hmm. In recent times, what we use is statistics, showing them before COVID, we used to have like 10, 15 people testing positive before the vaccine. I'm sorry. Now, all that is gone. We're still doing testings, and we're not getting, because majority of the people are vaccinated. And those that we are testing, we are not getting any positive right now.
That's compelling, actually. So understanding that the cases have gone down since vaccination started, it sounds like that has helped. Mm-hmm. Okay. When you reached out to caregivers, why don't you describe how you approached it? We learned yesterday that you would sometimes meet one-on-one with people when they came in for testing, but that the majority of your outreach was by phone. Tell me, how did you decide who to call? How did you approach that phone call?
We initially, we knew we had to reach all the caregivers. So we started with the ones who we knew or had acquainted with, had, you know, we have spoken to them before this. Not that the first they're hearing from us. We talk to them, you know, because our role, we have to communicate. But there are those that we have to now, they hear from us more than ever. So those are the ones we reach out first. And then, you know, the conversation, a phone call, hi, how are you? Introducing ourselves again, and tell them what this call is about. We just don't like, we just go straight to the point, what it's about. You know, hi, how are you? How you doing? How is your day so far? Fine? Nice. You know, you start by asking, have you decided on getting the vaccine, and what are your concerns if not? And then they'll say, and then they start, and we listen, and then we bring the facts to them.
Sometimes I say to them, did you have a reaction after you take your vaccine? And they'll laugh and say, I didn't take it as yet. And it starts a conversation.
That's a great entree, actually. That's wonderful. Did you find that for people who initially were hesitant and then decided to get vaccinated, was it just one conversation? You know, you pick up the phone, you call, and then they change their mind, or how did it work out over time?
3, 4, 5 times. You know, you have one conversation, you see this is not getting anywhere at the moment, or, you know, they start getting erratic, you know, defensive, tense and, you know, everything. You just say, okay, I'll get back to you. And you give them a few days in between, or sometimes a week. And then, you know, you'll call them back.
Sometimes they call.
Yes, sometimes they call, they want to know something. They heard something, so they want to confirm if it's true, or it's something about the vaccine. Is it that people are dying when they get it? You know, all that they see on and hear on the social media. So they may get back to us, or we get back to them. And, you know, and sometimes it's one conversation, questions. The second one, questions. The third one, questions. And then the fourth one,
think about it.
I'll think about it. Okay. And then they will call you back and say to you, can you tell me where I can go?
Can you make an appointment
to get
for me?
Vaccinated? And they expect us to make that appointment. And even if we are out of sight, you know, that were willing to take us, but because of their hesitancy, you know, those easy way to get into to get vaccinated, not there anymore. We have to ensure that we find somewhere to send them, and we cannot delay. We just, they're expecting us to make it happen.
One of their main fears was that it messes with your DNA. That was one of their main fears. And then we were able to convince them with the facts that we got, because we told them that we do these workshops where we get all the facts about the vaccine. And when we present it to them, somehow they take it, they believe, they have a change of mind.
Okay, and by workshops, do you mean the training sessions we did?
The training sessions with you.
Okay. So why don't we, thank you for sharing all that context. Why don't we switch now into the role play? So Vinette, or Marcia, are you going to be the hesitant caregiver again?
Yes.
All right, since you're together, let's see, why don't you try looking at each other and see, we can see how that works. All right, and tilt your camera down, your camera a little bit down. Okay, perfect. All right, so let's get started. I'm gonna go on mute. Imagine the phone is ringing, ring, ring, ring.
Hi, Marcia. How are you doing?
I'm good. How are you today?
I'm good. I'm Vinette, Director of Caregiver Engagement.
You're back again?
Oh, yes. Oh, sure. I like talking with you. I learn from you. You learn from me. We learn from each other. How are you doing?
I'm here, still thinking about what you said to me last week. Is there any added information you have for me?
What exactly or specifically you want to know? Because there's so much to know.
Yes, even recently, I'm really concerned about this vaccine going in my system, messing with my DNA. And even recently, they told me, I heard my kids talking that it will make people turn into zombies.
I'm gonna interrupt you with the zombies for a minute, just because I can't see your beautiful face, Marcia. Okay, perfect. So just if you scoot over a little bit, Marcia is cut off. There you go. All right, thank you. Okay, please, zombies.
I really don't want to put anything in my system to mess with my DNA.
I do understand your concerns, and I know that persons have that genuine concern, but I'm here to let you know this vaccine goes nowhere near your DNA.
How do you know that?
It sends a message, right? And it is outside. You have the cells, it's outside. Your DNA is in the center here, and it's around. It sends a message so that whenever the virus gets in your system, your body will respond to it. It goes nowhere near your DNA. It does not mess with fertility, your bloodstream, nothing. Your DNA, it's like here, and nothing goes there. It goes around it. And also, why do you think it would make you into a zombie? I have taken it. Am I a zombie? I'm speaking to you
How long
now.
have you taken it?
I took the vaccine way back in January. Initially, when it came out, I took the vaccine, and I am feeling okay.
You feel nowhere different?
Nowhere different since I took it. The first time I took it, of course, the area was a bit sore, understandable, and I got a bit tired the following day. Tired, I just wanted to lay in bed.
But my friends send me pictures of people that takes it and their face is swollen, they get sick, they have all different symptoms.
Okay.
And I've never heard about it on the news that it doesn't trouble your DNA or anything like that.
The news said it, but sometimes we do not listen for that. But it is in the news. But because of the social media, we get carried away. When you say now that your friend said that it messes up persons, and so on, have you had any proof?
Just the pictures that they send me through social media.
You know, we can doctor the pictures to make people think what they are. It is time. I am telling you, let me say something. Sometimes we need to educate ourselves and make informed decisions. Read what you don't understand. You speak with someone who is more knowledgeable than you to explain it.
That is true, but since this virus came about, how is it possible that a vaccine could come so in such short time?
This vaccine they have been working on this vaccine since the SARS, which is like in early 2000, because the coronavirus, it's a family. You see the different spikes and
But
so
I
on.
never heard of this before.
SARS, have you heard about
Yes,
that?
I do.
It's part of it. The flu, it's a virus, but it has different spikes. Okay, the coronavirus currently is one of them. They have been working on this vaccine since early 2000. Government has never invested so much resources, human and financial resources, in the manufacturing of a vaccine.
Yes.
So therefore, because of that, things have moved much quicker than expected because of the research that has been going on. And listen, it's not like 20, 30, 40 years ago when they were making vaccine. We have to know that things have changed. Technology has improved. People are doing research more in a different way than it was done 30, 40 years ago when we were kids.
Yes, Vinette, but you know what? This government is on a plan to do depopulation. And I understand that this is what this vaccine is all about.
And I understand your fears, because it was observed some time ago that, depopulation by the use of vaccine in, the poorer countries. But I don't think that's happening now, because people are now more open. We have the facts presented to us. And why would they want to depopulate a generation then? And every color possible has been getting the virus. They have been dying all over the world. So why would are they saying only us that are to get it? No. It's all over.
But you said you get the vaccine in January, but I notice you're still walking around with your mask.
Sure. I have to wear my mask because we do not know enough. How long will the vaccine work? Of course, it's new. And with everything that is new, it takes time. I have to wear it because I might be able to get the virus, but hopefully I will not be able to spread it. And if I even do get the virus, you who have not yet been vaccinated will get it in a much more serious way than if I got it who is vaccinated. We have to keep wearing the mask until we are sure 100% that we do not need it. But because it is still a possibility that we will get it.
So if I take the vaccine, I'll still get the virus?
You may. I am not telling you you're going to get it, because it's not said that you have to get it, because you very well may not get it, even if you take the vaccine. I have not gotten it. I have taken the vaccine. But the thing is, if I am vaccinated and I get the vaccine, if I'm vaccinated and I get the virus, then I will not end up on a ventilator.
Okay.
But if you who have not gotten it, then you may end up very sick and may end up dying. So it helps. it averts. There's no vaccine that is going to say you will never ever get it. You take the the flu shot yearly, right?
Yes.
If you get the flu, it's no more than 2 days and you're back to normal, and you're back to normal.
Well, with that knocking, why don't we pause there? I don't know if somebody needs you, but
Okay.
what I'm
I'll think about it and I'll talk back with you.
Stop. I'm gonna have you pause because that was wonderful.
The knocking.
You covered a lot of different types of concerns that come up in the conversations, but I want to make sure that there's time for questions. And it's 11:37, so I just wanted to pause and create some time for questions. I know you could keep going, and I know that your conversations with caregivers sometimes lasted, 15, 20 minutes and covered a whole range of topics, but let's pause there and just see if anyone in the audience has questions for you, not just about what you did in the role play, but they may have situations of their own where they want to seek your advice about how to handle certain situations with caregivers on their teams. So why don't we open the floor for questions? You can either raise your hand using Zoom, or if I put gallery view here, you can just unmute and unmask yourself and ask any questions. Do you have any caregivers working in your teams that are hesitant, and what are some of the things that they bring up so that Vinette and Marcia might be able to comment on approaches that might work?
Hello, this is Nicole. I was in the workshop yesterday, so thank you very much for having this second part, and these ladies are phenomenal with their approach and the information that they're sharing, so thank you very much. In the company that I work with, we work with individuals with disabilities, and we're a peer support group in Maryland. So part of the struggle that we're finding in getting people vaccinated is how to approach those with disabilities that have caregivers that may be apprehensive to getting the vaccine themselves. So would you have any advice from the individuals or the client's perspective in possibly bringing up conversations with their caregivers?
Okay. I would approach the client who has disabilities, you said, right?
Yes.
Okay. And their caregiver also has not taken the vaccine. They're apprehensive. So it leaves them open to two persons pretty much exposed to getting the virus. You're taking care of me. And what happens if I, as the client, has some underlying illnesses? You could bring that up, maybe diabetes, high blood pressure, whatever. Sometimes it's when persons get the virus, then they realize that they have underlying illnesses. So the way you can approach it is that you are pretty much open to getting it. If they don't have underlying issues, then what if they got it and had to end up on a ventilator? With their disabilities, they have some drawbacks then. So, they're not, and that's fine. But with that, their disabilities would be that they would not, their immune system is compromised, in my opinion, So if they end up not getting the vaccine, their caregiver does not believe in getting it either, and takes it to them.
And the caregiver that goes out, mixed with other family members, friends, on the bus, maybe, they're exposed.
Yes, they're exposed and comes back to them, you know, taking care of them. What could, you know, possible happen? So people take the vaccine, and you can let them know, because they're very selfish. I took the vaccine because I was very selfish, because I wanted to protect myself, my friends, and my family. It was all about me. And that's the approach that we should encourage them to take. And especially the persons who have underlying illness and have the disability, so they can be protected.
They are more prone to get the virus, so they need to be protected.
Okay, so if I hear you correctly, I think you're recommending that clients can appeal to caregivers, their caregivers who aren't vaccinated, by saying they're worried about their own health and that they really want that caregiver to help them to stay safe, because they may have underlying conditions or some kind of immune issue where they are at higher risk.
Yes.
That's great. That's great feedback for Nicole.
Yes,
Thank
and
you.
with the caregiver going back and forth.
Yes.
You know,
you never know.
You never know.
Wonderful. Thank you. So our next speaker is here, but I'm just going to see if there are any final questions. Hi, Brian. Any final questions for Vinette and Marcia? Any situations you want to share? Any feedback for them on their role play? Anything at all? All right. Well, with that note, I'm going to thank you both again for your encore, literally your encore performance. And the way we show appreciation is I'm going to give you a whole bunch of emojis. Anybody want to clap? Or I think you both are amazing. I'm going to give you some hearts, give you some, let's give you some love here in the emoji world. So thank you so much for sharing your insights as caregiver engagement specialists, as leaders, and as vaccine champions. You've really been doing a phenomenal job, and we're grateful that you spent time with us today.
Yes, and we have, just a footnote, we have about 220 active caregivers, and we now have 173 fully vaccinated.
Good job.
Yes.
Well then, keep up the good work. Sure. And thank you again for joining us. If you'd like to stay and listen to a legal discussion about mandatory vaccination, you're welcome to, but if you need to get back to work, which I suspect you do.
Oh, yeah. Not kidding. You know, if we could, I would love to stay and hear what he has to say, but unfortunately, but if we could get, you know, a tape, a recorded.
Absolutely. We'll share the links with you once it's all ready to go.
Okay. Thank you very much.
All right. Thank you. Take care.
Have a good one. Bye.
Bye-bye.